I'll be your CNA today. Excuse me while I wash my hands. Okay, Miss May, I'm going to help you brush your teeth. So let me get Chuck. Two cups, one for water, one for mouthwash. Toothpaste, mouthwash. Don't take lotion out, it's mouthwash, okay? And a toothbrush, and my gloves, and a towel. This is a very big towel, but I'll do that. I'm going to fill the cups with water. I will in a minute. Water and in both cups.
That's 100 per day.
Mouthwash can be very drying. So some people like it straight, but it can be drying. It has alcohol and other chemicals. I'm going to lock the wheels. I bring the bed up to working height. If the person's very tall, you may not have to do that because they're sitting high in the bed and you can see right inside their mouth. So I wouldn't have to do it for you. You're very tall. Okay. But for Miss May, I would sit her up. How do you brush or how do you clean somebody's mouth that's unconscious? What do you have to do? Huh? Yes, you would turn the whole body to the side so whatever fluid there is would drain out. You would put a chuck or a towel here. So as you're cleaning the mouth, the fluid is draining out. You don't want to do that if somebody's unconscious in a sitting position because you can do swabs. But if you're really cleaning the mouth and there's some liquid, you want to turn the head to the side so it doesn't go down. Okay, I'm going to put on my gloves. I put the towel, this is huge, across the person's chest. I'm going to wet the toothbrush. Add toothpaste to the toothbrush. If this is a real person, that's what I would do. You know, it's going to be new toothbrushes. And I'm just going to hold this. Make believe that Miss May has her teeth in her mouth. I would hold the emesis basin here. I wouldn't be holding her teeth. And I would ask her to open her mouth and I would brush gum line down. I turn the toothbrush around so I could get here. Then I brush the inside of the teeth, gum line down, flat surfaces. This is very simple for the state board, right? You just have to go around once. If you're cleaning somebody's teeth in the real world, you would be looking to make sure you got the turkey out of the teeth, the chicken, the mashed potatoes, whatever is in there, okay? The next one, I would brush the bottom. I brush gum line up. And this is in the person's mouth, right? I'm making believe. They have their mouth open. I brush the inside of the teeth gum line. And then I brush the surfaces, the flat surfaces. And then I'm going to ask the person to stick out their tongue and brush the tongue twice. That's all. For the real world, you may have to work on the tongue because it may be crusted, so you may have to do it gently, a little bit more.
What causes the tongue to get crusted?
Medications, oxygen, dehydration, the illness itself. Okay. So now I'm going to offer the person choices. Would you like mouthwash? Yes. Or water. So mouthwash. So I'm going to offer her, she's going to rinse and spit. Rinse and spit. You hold this here. Finished. I'm going to pat dry the mouth. Remove the towel into the hamper. Move this away. I'm going to rinse the toothbrush. The cups get disposed of. I rinse it, I disinfect it. At home, when we wash dishes, do we just rinse them and then put them away? No. You have to wash them. So anything you empty, you should clean with a disinfectant, okay? paper towel, I dry the outside, I dry the inside. I'm going to put mouthwash, toothbrush, paper towel, open up, put away. This gets disposed of. Remember, she doesn't have false teeth, she has her real teeth. I was just simulating. I remove my gloves. How do I remove my gloves? From the middle of the glove, and you don't want to have it in your face, right? So you're going to pull them away from your face. 2 fingers in, overlap, wash my hands, come back. Miss Nay, I hope you feel good. Wonderful. Here's your call bell. Can you reach it? Do you want to sit up or do you want to lie down again? Giving person choices. I lock the wheels. I lower the whole bed, I unscreen, and then I wash my hands again. Yes.
How can you rinse the residents with the resident's mouth if they are unconscious?
No, they're not unconscious. I asked the question, what would you do with an unconscious person if you had to give
you have
them?
to turn it.
So you want to either turn their whole body is the safest way.
What I mean is how can you put the water inside?
You don't put them out. No, you put it on a gauze.
Oh.
Gauze or a swab. You use a tongue blade. Everybody knows what a tongue blade is.
Floss.
It's
like
the wooden sticks that we used to go tongue depressors. When the doctor wants to look in our throat and they use the wooden stick. I don't know what kind
It's
of
like in the ice drop, yeah.
Huh?
It's like in the ice drop.
Yeah, like the ice pops.
Stick,
You know, have wide sticks. So you would take one of those and wrap it with gauze. So the gauze can help you open the person's mouth. You're not going to stick your fingers in the person's mouth, right? So you try to use the tongue blade, padded tongue blade, and then you would clean the person's mouth like that. Okay? Wearing gloves, of course. That's only for an unconscious person, but this person is conscious just that they can't do it for themselves. Okay? So that's what you have to do for brushing teeth, and you're going to brush your volunteers' teeth. You're going to have new toothbrushes, new cups, so you actually have to brush your volunteers' teeth. So you're going to go gum line down, inside of the teeth, gum line down, flat surfaces, lower teeth,
The water is
inside.
also 105 Fahrenheit.
No, the water can be tepid. It doesn't have to be hot. No. Your question, comment?
Twice washing hands.
I know, but you know, you're just going to brush gum line down. When we brush teeth, sometimes if we're brushing somebody else's, we brush the gums away from the tooth. So if we're brushing, we want to go gently from the gum